Did you know that 1 in 6 women in Canada experience infertility? And that figure is much higher if you are a Black woman. Black women are almost twice as likely to experience infertility as white women. In the U.S., they die of pregnancy-related causes 3 times more than white women. Black babies are twice as likely to die as white babies. Dr. Marjorie Dixon joins me now to talk about this issue. And I've heard all about this before, and you've heard all about this before, but actually, the facts are staggering. Marjorie, why is this happening?
Well, I think, we've talked about before myths and infertility, right? So people have misconceptions maybe about how things actually work. The definition of infertility being not being able to conceive after having a full year of unprotected intercourse the right way. And there's also myths around Black women and infertility. I mean, if you think about the things circulating out there is that Black women are hyper-fertile, right? Mm-hmm. Black women shouldn't have any fertility issues. And that is some of the undercurrent that contributes to the misconception, where when you actually look to the literature and what's actually happening in the population, it's a completely different situation. And that circumstance can be exacerbated by some of the ways that patients come to care and the determinants of health, social determinants of health. So how do people get referred for their treatment? Is it possible that the physicians who are referring them are less apt to refer a Black woman because of that misconception about the hyperfertility? So that could be one of it. It could also be that when Black patients are facing fertility issues, actually, they also don't have recourse to a lot of Black donors, egg donors and sperm donors. We talked about this in the past. So even if a Black couple presents, it's harder for them to get to their goals of family building by virtue of the chain of supply, right? And then there are other issues that might contribute to it, that Black women are more likely or more apt to have fibroids, for example. So sometimes when we're assessing patients for fertility, their ability or inability, there are anatomical factors, so factors in the uterus which might impact that. Black women are 3 times as likely to have fibroids than their white counterparts that are age matched. And that impacts your fertility ability. And also maybe even that misconception about being hyper-fertile, however it came to pass, was internalized by some of we women in the Black community. And so maybe we're less likely to present to care and therefore have a greater issue with fertility once we get there, when it's discovered.
There is an issue of mistrust between, I would say, Black communities and professional medicine fields, but particularly Black women. And that comes from somewhere. There's some trauma, there's some history there. Where does that come from, do you think?
Well, I mean, I think it needs to be said. History has been rooted in people having unethical treatments and experimentation on Black female bodies. For me as a gynecologist, it's somewhat conflicting because, one of the forefathers of gynecology learned a lot about what we know now in modern medicine and gynecology from experimentation on enslaved Black women without anesthesia, right? So history is there and the knowledge is there, and that's not only it. I mean, Black bodies in general, I mean, we know about the Tuskegee experiments, so they actually told Black men that they were being treated for syphilis, but instead didn't treat them and followed them to see progression of disease. Deceitful. And so unless we address the historical impact that can have on people's current trust of Western medicine and getting to physicians and care, infertility in and of itself has incredible stigma and difficulty associated with it. Add implicit bias and racism into that, I mean, it's not a question that women would be reluctant to put their trust in someone who historically has abused and been unethical.
We're in a situation now where we actually have, communities that don't even want to get the vaccine because of that mistrust of the system.
Yes.
So, this needs to change. And I mean, we still see articles about Black women or Indigenous women that are in surgery and what happens, what is being said during these operations that is, racist and biased and, very harmful to their health. So let's talk about what we can do to change this medical bias, Dr. Dixon.
Well, I think it's one, taking responsibility, and as a physician, there are opportunities for self-reflection. And I think that it's not just on an individual level that it will be also organizational within physician associations. I think it will be systemic, societally. How do we actually look for truth in what the prevalence of illness or disease is in Black women and infertility in particular? And look at studies, conduct the studies that need to get done so that we can get real information. And then further, self-reflection, I think, is critical to us recognizing in ourselves our own biases so that we can ensure that we're aware of who we are, why we think the way we think, and use that to inform ourselves when we're seeing patients and to ensure that we treat everybody the same.
Any other just tips you want to give to Black women out there who might be hesitant to get the resources they should be getting because they're thinking they're dealing with a system that doesn't care about them?
Yeah, so I would say learn to be an advocate for yourself, speak up for yourself, curate your care provider. I mean, you don't have to see the doctor you're referred to. You can say, I would prefer to see this doctor. I don't feel comfortable in that circumstance. It's your right to advocate for your own health care. You have a right to do that. And then also I think that we can have some positivity in this conversation because just yesterday I attended a session where we were looking at how biases inform how we treat our patients and how we can look to our past and try actively to be not just saying that we're not racist, but to be anti-racists in the way that we approach how we manage every single day. And so even if we see it or if we hear somebody else professing to some of the garbage that has been spewed in the past that's not real, that we have the ability to say that that's not okay, we need to change this moving forward. Anti-Black racism is real and it's changing. It is changing.
Absolutely. Thank you, Dr. Dixon. Always good to chat with you about these topics. We've shared resources on this topic on our website, cityline.tv. Obviously, a conversation that could go on forever and ever and ever. We'll pick it up again on another episode, Dr. Dixon. Thanks for